Hi, good morning. Once again, it's Dr. Cisse. Today, I'm going to continue with the series of videos that I started doing reference to prevention of mental health illnesses. And for those of us, or those of you who are following my video, I've talked about a few things. The whole idea behind this video is focusing on general public. So anybody should have some sort of benefit through it. And my intention is to provide science-based evidence with reference to these mental health illnesses on how to prevent them, help making or supporting or helping individual to take personal sort of responsibility to deal with the condition rather than going through pharmaceutical sort of type of intervention, because any medication that you put in your system will cause you a problem, whether you know it or not. So we rather prevent things rather than taking medication to cure it. And that's one of the reasons why in my videos I don't talk about curative medicine, because in my experience, prevention is better than cure. So on that note, today we're gonna talk about ADHD, attention deficit hyperactive disorder, ADHD. Now some people call it ADD, attention deficit disorder. It's changed to ADD, but by through the diagnostic criteria, so the H is added. Now, when we talk about ADHD, attention deficit hyperactive disorder, it is absolutely a massive area that I personally think it's a very debilitating sort of disease or disorder that affects families significantly, particularly the Afro-Caribbean population. And I feel devastated when I see families who have young children who have this condition. It's such a difficult thing. So today the concept is to understand what ADHD is all about, the cause of it, the neurobiology of it. In this video, you realize that we'll go into neurobiology. This is important because the video is not only for ordinary people to look into the surface of it. We want intellectuals, we want students to benefit from it. So everybody should have some benefits. So if you come to a point where you think the information is getting too deep for you, there is nothing wrong to turn your phone off or to ignore that bit and continue the other side that benefits you. So please feel free to watch what you think is relevant to you. So attention deficit hyperactive disorder. The first thing we're going to talk about attention. Now, the word attention is the same thing as when you say focus, and it's the same thing as when you say concentration. Now, people sort of misunderstood these terms. They all mean the same thing. Now, what is important is that people don't understand attention is actually has a neurobiology signature. That is a chemical in our body that is fully responsible in terms of our attention. And this is what makes it even more exciting, because this is what we're going to learn today. So, to get to the basic of it, we talk about our thought system, our thought process. Now, when we think of something, it generates a feeling. The feeling generates, let's put it this way, you thought of something, that thinking process have a frequency, message. That frequency or that message generates a perception. Now, this is all about perception. Now, say, for example, you're having a conversation with somebody. You and your friend are talking in a party, and then while you are talking, let's say a young, pretty lady just passed by, and just automatically your friend's attention is being driven to that young pretty lady. You realize that you'll be talking to your friend and your friend can hear you, but your friend cannot understand you. And this is why it is important to understand what the attention is all about. Because if you don't pay attention to whatever is around you, you cannot hear them. You can have the stimulus, you can hear people talking, but if your attention is focused on something, that's where you understand what's happening there. And this is why when we talk about dopamine as a neural signature, as the only chemical, body chemical, so dopamine is a body chemical. It's a chemical that our body produces, and it is responsible for our attention. And it do two things in the body. It acts on two pathways. We call it default mode network, and we have task mode network. Now the default mode network circuit and the task mode network circuit, they're all in our brain. These network systems are in our brain, and we'll go deeper into that. But before we get into this process, what I want you to understand is when you have dopamine, when you see somebody that attract your attention, what happened at that moment in time, your body produces dopamine. What dopamine does, it takes your attention to perceive, to a task-oriented attention. So your perception is drawn away from what you are, where your environment is, where you are at that point in time. The dopamine draw your perception to a task-oriented perception. So you start focusing to that young lady. Not only you looking at the pretty of that young lady, your mind started looking at every bit of that thing. So your focus, your attention, your concentration is all about that person at that particular time. It doesn't matter who is talking to you. It can be your father, your brother, your sister, whoever, your friend. They are saying, you can hear it, but you don't understand what they're saying because dopamine make you concentrate on the thing you want, your task. This is why this pathway is so important. But we'll come to that. It's getting a bit more exciting. But before we go into that, we want to know what dopamine is all about. Now, dopamine is a neurochemical. Now, there is two schools of thought when it comes to attention deficit hyperactive disorder. One school of thought say that it happened because we have low level of dopamine. Another school of thought say that it could have been a disorder in a part of the brain where this process happened. Now, we'll come to deep into that and we'll make a conclusion. But to come back to dopamine, as a neurotransmitter, the body produces it, but we can also get dopamine from our food. So if I meat eater, or banana, or fish, or avocado, the list goes on. There are some of these foods that are very rich in dopamine. So eating this food will make your body produce more dopamine. So instead of having a low dopamine, which could be the cause of ADHD, diet can actually help your dopamine level to go. So because people think it could be related to low dopamine, but it can also be related to disorder of our brain, which is genetic. Don't forget that. It's not something that you only get it through families, which is genetic. So we are going to look at that dopamine processing. If your body can produce it and you can get dopamine from diet, why do you need a doctor to prescribe you medication that can increase your dopamine when you know that those medications will cause a side effect? Any medication that is produced, that is given to you to increase your dopamine, belong to a group of medication called stimulant. Now, these stimulants can be cocaine. I'm not saying it's cocaine in medication term. It's a changed version of those stimulant opioids. Those stimulants such as crack cocaine and amphetamine, that sort of areas. But we're not going to go into illicit drugs because that is a special area to talk about. So instead of medication, we will think about diet, how to prevent these ADHD happening by just concentrating what sort of diet you could eat or make somebody eat to increase their dopamine level and to prevent ADHD. Now, in our diet, what happens when we eat this meat, banana, the rest of it, they change it into what is called amino acid. Now, this amino acid, what happened in its form, it changed into precursors. Now, the precursors are the chemical, the substances that actually modify to change it to dopamine. So, the precursor of dopamine is called thyroxine. Now, thyroxine will change into L-dopa. Now, L-dopa will change into dopamine. So, if you eat meat, you eat banana or you eat avocado or fish, your body process that as food and it change everything in the stomach. And by the time you get into your small intestine, it change into the nature of everything is processed, and then you have amino acid generated from that food. When you have the amino acid generated from that food, that amino acids change into precursors, which is in the case of dopamine, is the thyroxine. Now the thyroxine will change into a form that will make into a neurotransmitter. So the thyroxine will change into L-dopa, L-dopa will change into dopamine. Now dopamine is a neurotransmitter. Now it's important to understand that when we talk about neurotransmitters, we have mentioned neurotransmitters in the past. But the importance of neurotransmitter, particularly dopamine is such an important neurotransmitter. Not only does it So dopamine not only does it increase your concentration or attention, your focus, your concentration, it motivates you. It's a motivator. It's a goal-oriented chemical. So it goes on. It has a lot of positive things. It does quite a lot of positive things. But as a neurochemical, it behaves two ways. One way, it can act on synapses as a neurotransmitter by himself, or the other way, it can act as a neuromodulators. So neuromodulators, which means that when dopamine acts as a neuromodulator, it can have an influence. It will be like a supervisor looking after other people, telling them to do what they're supposed to do. So as a neuromodulator, it acts like a supervisor telling other neurochemicals how they should behave, what they should do, where they should do it. And that is important in ADHD, because when we talk about this default mode network and the task mode network, this is exactly what dopamine will do. We'll come to that to verify and clear it out. Now, having that basic knowledge of dopamine, having that basic knowledge of attention, understanding attention deficit, what it means. Usually, I don't talk about the symptomology of these disorders, but people who usually have attention deficit, they have ADHD, they have issue with their attention. Not do they only have issue with their attention, they become hyperactive. Not only do they become hyperactive, they become really impulsive. And this is one of the most important one. This impulsivity, because this causes a clinical condition called chaotic challenging behavior. Now this is difficult. And I feel sorry if any one of you who has children who experience this problem, you know what I'm talking about. This child cannot concentrate, this child cannot sit in one place, this child get angry. Some of them go to the extent that it can lead them to self-harming. They will run and hit their head on the wall, they will break things, they will throw things, they will fall in, they will drop themselves on the floor, roll and roll. It's absolutely a nightmare. It's so difficult. It's so hard. As a parent, it drives your energy completely out of your sockets. But I don't usually talk about symptomology, because symptomology leads to treatment. And as I said, curative medicine, it doesn't mean I don't do it. I promote preventive medicine than curative medicine. The reason if you become responsible for your health, you're more likely to maintain good health, rather than depending on a doctor to give you medication to make you better. So enough of that. So we know that the neurosignature of ADHD is dopamine. And we know that dopamine we can get it from our food. We know the process how food is changing to dopamine. But another thing we know that dopamine work on this neural circuit, as I said, default mode network and then task mode network. Now this network of circuit, we call them circuits, C-U-R-C-I-T, circuit. Now this network of circuit work this way. So you have task oriented, you have default oriented. In a healthy person who doesn't have ADHD, what happens is that these two networks work in opposite direction. One go right, the other go left, or one go up, the other go down. So they balance each other, they counter interact so that they anti-correlate each other's movement. So they are anti-correlating. One go left, one go right, one go up, one go down. So it's like that in a normal circumstances where the person has not got ADHD. So if you don't have ADHD, this is it acts as an anti-correlation. So there's anti-correlation part where one go up, one go down, one go down, one go up. So they act like that. So it's very, very orderly done. And what happened in this process is that dopamine, we're going to talk about it, is responsible for this process. And this happens in part of your brain. Remember when we talk about our brain, we mention our brain as having parts or sections. I'm not good in drawing. I'm just going to draw something that you can probably understand. So we got our brain. We got our brainstem. We got our cerebrum. And we got our cerebrum. I'll have to write that because these two get confused with people. Cerebellum. Okay, in this cerebrum is also called as cerebral cortex. Now this cerebral cortex is divided into what is called lobes. Lobes. Now you got occipital lobes, which is behind your back. You got parietal lobes at the top, frontal lobes, and you got your temporal lobes. Now, what happened in this default mode network and task mode network circuit, the part of the brain that is responsible for these are your lateral, it's called dorsal lateral frontal pericortex. It's a big terminology. I'm not going to write it down, but it's called dorsal, meaning top of your forehead, prefrontal, your forehead. The brain in the front. So dorsal lateral at the side, prefrontal cortex. So it happens in your dorsal lateral prefrontal cortex. And another action happens in your temporal lobe. So your temporal lobe, and another action happens in your medial prefrontal cortex. So you get these three parts of the brain involved in this task. So you get that three parts of the brain here involved in this coordination. But the beauty of it, dopamine became responsible for this. In a healthy person, dopamine is like acting as a conductor. It stand there, it tell this one, you go on, this one go down, this one go up, go down, go up, go down, go up, go down. And it's activating. If you look at the MRI scan in the brain, how this operates, you'll be amazing with creation. Everybody gets amazing with creation anyway, but this will make it even more amazing with how God created us. So it's amazing. It's absolutely amazing. So this dopamine is making this default mode network and task-oriented mode network to work in seesaw. If you like a seesaw, one go up, one go down. And it's telling you, hey, it's your turn, it's your turn, it's your turn. That's dopamine responsible for that. Now, the theory is, if you have ADHD, that is a problem. And the problem is this. Your default mode network and your task mode network, they don't work in opposite direction. they work together. And this is the confusion. It's like you got a guitar, you're a musician, you got a guitar, you got a drum, and you get a bass, and you play all of them at the same time. This is exactly what happened in the brain of people who experience ADHD. So your dopamine is not in control of this movement at all. So that's a theory in this. Whether it's because your dopamine is low, and that's why these chemicals don't listen to him. As a supervisor, if he supervising 3,000 people and 7 supervisors meant to be on the site, and you only have one supervisor, you realize what happened. None of them will listen to you, and that seems to be the thinking. That because there is low level of dopamine, this behavior, this process here are not they are not listening to the supervisor. So as a result of that, they're just doing things. They all go right, or they all go left, or they all go up, or they all go down. So they are chaotic. They are messing about. So there is a continuous bombardment of them working together, making this movement confusion in your brain. So that's one theory. It could be due to low dopamine, and this seems to hold the most clinical evidence, because it's realized that when you increase dopamine level, this system come back to normality. If you grow up, for some reason, even though people think it's genetic, for some reason, when people grow up, they grow up after this. The whole ADHD thing just disappear. People are still fine. And if it is genetic, how could that be? How could it be? But the possibility that if it is due to the malfunctioning or low level of your dopamine is possible. As you grow older and older, either your diet is changing, you're eating a lot of milk, lot of meat, lot of fish, lot of fruits. As a result of that, your body is taking so much dopamine, and your body's dopamine level get balanced. As a result of that, this problem is sorted. Or your body is naturally producing this dopamine, such a level, because you are growing up, you are getting matured, your organs are all getting functional. So as a result of that, the dopamine level increases and this condition disappears. So the question is, if it is genetics, how is it that when people get older, this system still disappear? If it is genetic, that may not be the case, because we know so many genetic diseases that doesn't just disappear. So that is basically what ADHD is: attention deficit hyperactive disorder. As we have already spoken about the symptomologies, we talk about the dopamine pathway, the low dopamine hypothesis. We talk about the default mode network circuit and the task mode network circuit. We talk about the part of the brain this circuit happens, and we talk about the supervisor of this whole process, the dopamine. So in effect, one can assume that if you have a child or a relative or anybody who has this ADHD, to prevent it, first of all, look at your diet. Look at the diet. Diet seems to be the fundamental element that people believe can be responsible to actually treat your ADHD, or prevent it continuously growing up. So you can either treat it or prevent it. So if that is more likely to be the treatment pathway, why do you have to go to your GP to get a treatment, to get a prescription, to get a prescription for this condition? Knowing that any medication, if you go to pharmacology now, we're talking about pharmacodynamic and pharmacokinetics, but more often the time in this particular case, when we talk about pharmacokinetics of certain medication, that is just an example. I'm not going to go, as I said, I don't go too much, I don't go into treatment pathways, but if you look at the pharmacokinetics of some of these ADHD medication that they prescribe to people, say for example Ritalin, if you take Ritalin, Ritalin is a modified type of stimulant. Okay, so stimulants such as your cocaine, amphetamine, name it. So it's a pharmaceutically modified type of this. And what this does, it acts on certain receptors in your brain to activate those receptors to increase your dopamine level. So again, it's about increasing dopamine level to treat the condition. So the whole concept is to increase dopamine. You will also realize that when you have a child who has ADHD, they are craving for sugary materials, chocolate, sugar, name it, drinks that are sugary. Their craving is higher. They can have certain amount of that sugary drink, and if you give that to a normal child, that normal child will go bonkers. That normal child will be restless, but they can have that and it will not affect them, because what happens, it increases that dopamine level, would get control of this seesaw, this default mechanism we're talking about. So, but if you're giving that to a normal child who doesn't have ADHD, what you are creating the dopamine level for that child to go up. We know that dopamine also work on a sort of a balanced nature. Say, for example, 1 to 5, 5 to 10, or 0 to 5. At 0 here, you are going to be absolutely depressed to a level that is crazy. So up to 3, you fall into that depression path. Maybe up to 4, minor depression. If you go up to 5 here, this is the optimal level where you become motivated, you become lively, you become like goal-oriented, you become concentrated, focused, attention became great. So this is the optimal level. If you creep this side, what happens is that you start getting excessively hyperactive. Not only it became chaotic and challenging, you end up actually hallucinating. This is why people who have schizophrenia, functional mental health disorders such as schizophrenia, bipolar, schizoaffective disorder, this is very common to them to have their dopamine level going really high up, and it happens in certain part of the brain. We call it the mesolimbic cortical pathway. We're not going to talk about that today, but we will, I promise you. So to make a conclusion on this ADHD discussion, it's about you understanding what causes ADHD. It's all about dopamine. And how would you do? Just a very cheap version of it. Look at the diet your child is eating. Look at the diet you're providing to your child. If you are increasingly giving a child certain food that the child's body will not produce dopamine, you technically making that child to have low level of dopamine. So eventually that child will develop this ADHD some point in time. To avoid that is to look into this healthy diet. As I said, the food that are rich in dopamine: meat, fish, avocado, banana, and the list goes on. If you Google it, it will come up and you will have different choice. And try it, see what happens. Because as I said, families who have children who have this condition, they know what it means. It can drag your energy out. But not only that, it put the child at risk. It put the child at risk of head injury. It put the child at risk of serious accident. It put the child at risk of being labeled, particularly in our generation of this school nowadays. You get children who become who have these attention deficit problems. They start putting them in groups. And what is happening in that, I'm not going against the school system. I'm just saying this so parents can understand and work on it. Because if your child is assumed by the school that they got ADHD, attention deficit hyperactive behavior, and they felt that because he's not paying attention, he's not focused, he's not concentrating, he's messing about, it's difficult to sit in one place, and so they would put him in particular isolated group. They either make him live by himself to do his own thing, or live in a group of people who have similar presentation. And what that does, that sort of solidify, that sort of make the child even getting more into ADHD, because what happened, you are allowing that child to practice behavior that is constantly making that neuron, your dopamine level, to drop. But not only that, the neuron that fire, the brain part of the body that recognize that balance system, making it chaotic, you are enforcing that to happen. That is something that we call neuroplasticity and neurogenesis. Now, neurogenesis is the increasing number of neurons in your brain. It normally doesn't happen. It's a fancy word, but it's very rare for your brain to produce new neurons. It does happen, but even if it happens such a level, it is technically, medically very negligent. But neuroplasticity happens. Neuroplasticity is actually strengthening the socket. It's strengthening that socket to recognize certain behaviors and to make that behavior as sort of like your personality. So if you reinforce that behavior continuously, if you put that child in that group and then eventually send the child to a special school, what are you reinforcing? You're reinforcing this condition to stay with that child. And if you don't take positive action, the chances is that your child will live in that situation, because children don't make the decision. We make decisions for them. So be very careful what sort of decision you have to make it for your child. Children grow. As the body grows, the neuroplasticity happens until the age of 25. Thing changes in that level. So don't get into conclusion. Don't jump into conclusion about ADHD. The school are very good in prompting you, signing papers, doing all these things. I have nothing against school system, but I think they should be really very careful how they do this, and they should be working with parents, and they should allow parents in their own space to look after their children. And if you have to take anything from this video, think of how dopamine is produced in the body. Think of the food you can get dopamine from. Look into the diet of your child. Don't jump into conclusion about these illnesses. Take your time, get advice, read about it, see what support you can give you to the child. Thank you so much for listening.